Hello, everybody. My name is Brad Kramer. I am a consultant, safety consultant with Provenio Consulting. I'm going to talk today quickly about different types of respirators and different things that businesses should have in place, specifically as we talk about coronavirus, the COVID-19 pandemic going on. I think there's a lot of misinformation, a lot of emotional information. We're probably not going to get sorted out what is the right answer on whether to wear a respirator and everything like that for a long time. So it's going to be, as a business owner or manager, using your best judgment on what kind of preventative measures you should take, what kind of policies you should have, and stuff like that. So real quick, the first thing I'm going to go through is the types of respirators. I'm not going to get into the full band of respirators like SCBAs and HEPA filters and stuff like that, just kind of what's common out there. The businesses may be turning to for protection during the pandemic. The next thing is I'll go through the requirements on what OSHA has for requirements for a respirator. So what kind of policies and measures and stuff like that you should have in place. And then lastly, we'll just kind of talk about, discuss some factors real quick, some things you may want to consider as you take into account what kind of respirator you should require and stuff like that. All right, so the first one, starting out with probably the simplest, surgical mask. So this is kind of what we see a lot of people wearing around town and stuff like that. Very, very inexpensive, cheap mask. So it just goes over like this. And when we look at this type of mask, there is no seal, right? A lot of what I breathe out is going to come right out the sides, right out the front. If I'm wearing glasses, they're going to fog up really quickly with most styles of this mask. The reason being is that all the vapor and everything that I'm breathing out is going right up on the glasses. So we can see physically that there's a lot of vapor, a lot of water vapor coming out with these. So they're not doing a whole lot of protection either way. When we look at this type of mask, see the blue side and the white side. The white side is more like a sponge, all right? This is going to absorb the water droplets as they come out of your mouth. And the blue side is more like a vapor barrier. This is going to kind of hold the water droplets in. All right, so kind of some of the considerations with this. This is going to give you very little protection if somebody else breathes a virus my way. If I'm in a room and there's a virus floating around, this is not going to filter out the virus for the most part. And it's not going to offer me a whole lot of protection. For one thing, like I said, the air can come right in the sides. The other thing, the filter isn't very thick. If I hold this up to the light, you can see right through it. This does not filter out viruses. All right. So, main thing with this is it's there to protect. The idea is that if I sneeze, when I spit, when I talk, that kind of stuff, it's catching that spit, the water droplets that are carrying the virus, and it's going to hold them in here. All right. Next most common here, we have an N95. All right. So while I'm taking this out of my package, this is my personal N95. So you always want to make sure that employees keep this includes these as well, keeps these stored in something. All right. If it's an N95, they should dispose of it at the end of the day. So they want to take this, throw it in the garbage can. If they're going on lunch break or anything like that and they're going to be setting it aside, you shouldn't just lay it around somewhere because somebody else nearby coughs or sneezes and everything settles right into it. Somebody's sweeping the floor or whatever, all that crap gets right into it. I put this mask on, I breathe it right in. So all your masks should always be stored in something between uses and with the person's name on it. So it doesn't get confused with somebody else, right? The last thing we want is two people mixing it up. One of them actually carries the virus or tuberculosis or anything else. They mix up their mask by accident. The person puts on the other person's mask and they end up catching something, all right? So N95 mask, these are rated for between 0.1 and 0.3 microns. The coronavirus is approximately 0.12 microns. All right. The name N95 means it captures approximately 95% of particles above that 0.3 microns. So what that means is there's still going to be, if let's say I take in a breath and I breathe, 1,000 virus particles, I breathe them in, it's going to capture approximately 95% of them. Okay. So that means 950 approximately 50 would still get right through the mask. All right. So what's going to alter that? How breathe do I do? If, let's say I'm going to sneeze, I breathe in really hard, that's going to pull more stuff through. Or if I breathe out and I sneeze, it's going to push my water particles and vapor further through it. The other thing to keep in mind with this, let's grab a pencil here to show you something. When we see an N95 mask or any other type of respirator and it has this little plastic cover on it, but this is a diaphragm. This makes it easier to breathe, right? What that is, and I'm going to get right up to it here, all it is just a little rubber tab, right? So when I breathe, to make it easier for me to breathe, that tab opens, right? Keeps the mask a little cooler, easier to wear. But if I'm wearing this mask for other people's protection, my breath is going right through that diaphragm and out exactly where it would go if I was breathing out anyway. So I'm sitting here talking, my breath is mostly going like this. If I put this on, my breath is coming right out here, all right? So be aware of that if you're requiring these types of masks for protection of other people, you may want to rethink that little diaphragm on it, all right? So N95 mask. A very similar mask to this is going to be an N99. That means it's going to capture 99% of particles above that 0.1 to 0.3 micron rating. Now, different mask manufacturers have different levels of quality. So your highest quality ones, your 3Ms and your other well-known mask makers, they're going to be closer to that 0.1 micron. If we get into off brands, they might be 0.3 microns, and they're not going to filter out that virus. Now, still, this isn't going to offer a whole lot of protection for that virus getting through it. That virus is very small, okay? So that's the N95, and what we have here is very similar to it. This is an R95. Looks almost identical, other than the fact that it's a little more gray in color. So it's an R95. So what this is going to do is this is going to filter like your solvents and stuff like that, your oils. All right, so this has more of a manufacturing intent for it, right? Now, if this is all you have, this is going to work just as fine as this. It's going to maybe be a little warmer to breathe in because it's going to be a little thicker because it's got different type of filter on it designed to capture those solvents and stuff in the air, more gases. Okay, but that's what this is. R95, pretty much going to capture the same particles that this is, just be a little bit beefier. And very similar to the N95, the R95 is going to capture 95% of those particles. Okay, you want to be careful with these. If you're buying an off-brand, if it's not like, from Granger or directly from 3M, something like that, you want to be very careful about what type of mask you're getting because, let's say I see on it KN95, right? KN95 isn't an American. You want to look for NIOSH. So right here we see NIOSH on it. This is NIOSH basically approved this mask. There's a lot of counterfeits popping up because supply and demand. A lot of companies were scrambling to buy PPE. So companies in other countries and all that kind of stuff started pushing a lot of product through that does not meet NIOSH's guidelines, right? That doesn't mean that some foreign company can't just stamp NIOSH on it and say it's an approved respirator. So be careful where you're getting that from. The other thing is, counterfeit brands. I mean, I saw one that looked just like Black & Decker. The brand name was Black Deck, and it designed the lettering and stuff to look like Black & Decker. So an American consumer sees that brand recognition. Ooh, Black & Decker, here's my mask. All right. That mask was probably a piece of crap and not going to do anything for you, even less than this was going to do. All right. So then here we have a half mask respirator, right? This is my half mask respirator. This is what I use quite frequently when if I'm blowing insulation, if I'm doing sanding, woodwork, all that kind of stuff. All right. So this is probably going to be a little bit of overkill. Same thing with the N95 mask. It's got a little diaphragm here. So actually, I pop this up here. When I breathe out, my air goes right out this diaphragm, so nothing filters coming out. All right, when I breathe out, nothing gets filtered. When I breathe in, it's going to go through I have a vapor canister, so this is going to be more for your vapors. like if I'm spray painting and stuff like that. And this here is a particulate filter. All right, so this would be like if I'm sanding or sweeping and stuff like that, that's going to have more dust particles. All right, so these are going to capture a whole lot more than this is, but it's going to be a lot warmer, more difficult to use. There's different sizes. I definitely need to be fit tested for this and stuff like that. All right, so just a real quick rundown on the different types of respirators. So what's required for you as a company? Right now, OSHA has they suspended some of their fit testing guidelines. But generally, if you're an employer and you require your employees to wear any type of respirator, that does not count surgical mask. If you require a surgical mask, no requirements as far as respirator policies and stuff like that. No fit tests. So not for this. So what I'm talking about is N95, half mask respirator, and other respirators. So if you're requiring them, you need to have a policy in place. So that's going to say, when employees have to wear their mask, what kind of protection those masks wear, how often those, or what kind of protection those masks offer, how often they should be changing those masks out, guidelines for how to wear them and stuff like that. All right. So you need to have some kind of policy in place. If you need one, let me know. I'm happy to help you build a policy. The next requirement is a medical questionnaire. So what that is a doctor looking at that person and saying, I find them fit to wear a respirator. Because if I have asthma, if I have a heart condition, any lung condition, anything like that, even being claustrophobic, or if I have different facial features, let's say, for example, I had surgery and I had a scar right here. The doctor might look at that scar and say, that is not going to seal. That person should not wear a respirator. Some people have different bone structures in their face, stuff like that, or real hard creases. Like some people have real strong creases from facial features, and air, no matter what they wear for a respirator, air will still get in there. All right. So the point of that medical evaluation is having a medical professional look at that person and say they can or they cannot wear a respirator. All right. So I can't do those kind of medical questionnaires. It has to be like a doctor or a nurse or some kind of medical surveillance company. Chiropractors can often do it. Your family physician can fill out the form for you. Occupational nurses, those kind of people can approve these. The next thing you're going to need is going to be a fit test. All right. So in some instances, OSHA has suspended fit testing. All right, especially for the annual fit test. So they put out 2 guidance documents. Very easy to Google. Just Google OSHA suspends respirator fit test, for example. Right. A guidance document is just that, a guidance document for the OSHA inspectors. It does not mean that they're going to come in and say, oh, you don't have to do anything. Or on the other hand, maybe you have a retail store and you're just requiring N95 masks. That OSHA inspector may not care that you didn't do a fit test, right? It's really going to vary based on who that inspector is and a lot of other variables. Now, for example, if I was, let's say I had an asbestos abatement company, right? They're going to be a lot less lenient of letting me get by on my fit testing versus a retail company that's making employees wear these kind of as a means of extra protection, right? Big difference. So that's going to be something that OSHA inspector is going to take into consideration. So you need your fit test, which in some cases is waived right now, medical evaluation, and a policy, all right, a respiratory protection policy. All right, and just some last thoughts to leave you with here. Right now, it's very emotional on both sides. Should I wear a respirator or not, or a mask, right? And I see the points of both sides. If I'm a typical person that I never wear a mask, I'm not used to it. I put this on, I'm going to be rubbing my face and it's going to bother me. And I'm going to be, when I take a drink, I'm going to be, pulling it up and everything on my face rubs into it. I get in my car and I've been wearing gloves that I've been wearing all day and I start touching everything. I mean, this mask is not doing anything for you. So there's, and we're seeing different guidance from, WHO, the CDC, a lot of doctors. Everybody has their opinion right now. And quite frankly, nobody's right. It's going to come down to what makes you feel better as a company. All right. Frankly, I think a lot of the requirements are more about liability. Having something in place better than nothing. Is that something actually better? I don't know. I can't be the judge of that. You have to judge that for your own company. And what do your employees feel? What do your clients feel? Or, yeah, your clients, your employees. Do you have guidance from like an insurance company or somebody else that oversees you or your franchise? So a lot of things are going to come into play that are going to be personal to you to make that decision. All right. So now, if I require, for example, customers that come into the store, I might be getting into trouble. For example, if I say you can't come into my store unless you're wearing some kind of mask, I don't care if it's an N95 surgical mask or a piece of screen, right? That person might say I have asthma. If you say, well, you can't come in if you're not wearing a respirator, that person might have grounds to come back and sue me. Now, I think with everything going on with government and stuff like that, there's going to be some protections in place, so people can't sue you for that kind of stuff. But it's going to be a murky area. There's going to be, some litigation going on. We're going to see cases, and courts might throw them out. Protection laws might come into place for businesses and stuff like that. So let's kind of be conscientious. What do your clients want? What do your employees want? If all your employees are saying we don't want to wear masks, you might want to take that into consideration unless you're in a very sensitive field. For example, if you're a dental hygienist, right? Where you're really kind of right in your customer's face and a lot of interaction going on with your breath, right? So kind of take that into consideration. Really look at these and what do they really do? There's a lot of different qualities. I have to wear these in some places I go. In one batch of masks I had, after a half hour, it was horrible because all these fibers started really kind of coming out and making your nose itch, and you couldn't help but just rub your mask until you replaced it. All right. Otherwise, you'd sit there and start sneezing. All right. So different quality of masks. How do your clients and employees feel? All that kind of stuff. Now, let's say you're going to go the whole 9 yards and you're going to have your employees do a fit test. And let's say an employee has asthma or they're claustrophobic and their doctor says this person should not wear a respirator. Now, this might be more of a question for your attorney. I'm not giving legal advice, just some things to think about. If you let that employee go and you hired that employee, say, a year ago, and their job description did not say you have to wear a respirator, and all of a sudden you make that policy, you have to wear a respirator, because that's what this is, a respirator, and that person can't wear a respirator and you let them go, that's not in the job description. They might have grounds to come back for a lawsuit. All right. So be very careful. Have that planning in place for what if an employee refuses or cannot wear the type of respirator that you're requiring. Okay. So a lot of considerations in there. I'm happy to answer any questions to the best of my ability. Right now, there's a lot of things changing. So I don't have answers to everything. Some things are going to be what feels right for your customers and your company. What level of protection, what level are you comfortable with? All right. Maybe just getting all the facts together and having a safety committee or another group of employees or managers coming together and saying, all right, we're just going to decide on something based on consensus, and that's what we're going to go with. Otherwise, it might be a lot more scientific. Got to decide what's right for your company. All right. So hopefully I answered some of those questions for you. Feel free to reach out to me, Brad at provenioconsulting.com, BRAD at PROVENIO consulting.com, or reach out to me here and ask a question in the comments. All right. I'll do my best to answer any questions you have. Thank you.